We plan wonderfully to go on vacation. A pregnancy is the most extraordinary, fabulous thing to happen to the human body. And we should likewise be as prepared, if not more so, with an eye on a great result and ready to handle anything that comes on the sides. I have a friend who was a labor and delivery nurse. People who came in with their kit, their little handbag that included their pajamas, the baby's first diapers and onesie, and they were all prepared for that part of the delivery. I don't know, like some of the birthing plans are like, what kind of music do you like? And what, like, do you want your partner to hold your hand or not hold your hand? You're not thinking about any of that stuff when you're giving birth. But they were in no way mentally or physically prepared for the challenges that happen. And so part of that emergency preparedness that I agree, I wish that we were talking about this in prenatal classes and not just about how to breathe and where to prop the pillows, but how do we talk about making sure that your blood health is optimized? If anything should go wrong, what if I want to have a natural delivery and I need to have a surgical delivery? How will my blood be managed? How will they protect me from losing blood? What am I comfortable with if I'm faced with needing a blood transfusion? Or can my issue be solved with an iron infusion? So being prepared for all the best, but also being prepared for those challenges should go alongside that little kit that we commonly show up prepared with. Some of the critical things, like, what happens if something goes wrong? Those are probably the things that people really need to be thinking about. And it gives your healthcare providers, your whole team, all of the information they need to go ahead and act quickly. If they don't know your feelings about iron infusion, certain medications that control clotting and get bleeding stabilized, your feelings about blood transfusion, should it become a question, then they're having to stop and ask and deal with this at a time when you are so high stressed. That's not the time to make good decisions.
We need to really, the days of just showing up and delivering are, they should be in the past, because there's a lot of things we need to do to get a mom ready to deliver and to have a very successful, healthy transition to motherhood.
The challenge is that people are not tapping into these things. People are not taking advantage of resources around them. Like, a lot of them have the concept that it's expensive in order to go to the hospital. So they have this phobia to actually seek for help.
But yeah, it is a delicate balance because, as a woman, when you're pregnant, you're already nervous. You're already, worried and stressed about the health of the child, right? So you don't want to add on another layer of stress. The reality is that many women in the world die giving birth to children. It is a traumatic event on your body. It is not easy. And so I think these kinds of conversations need to happen more.
I work in one of the poorest states in the country, which is Sabah, where I see, unfortunately, many mothers who lost their lives to postpartum hemorrhage. But I also found that there were mothers who died because of heart failure following anemia in Sabah. So that was shocking to me. That was truly very shocking to me.
Wouldn't we want, as a society, to make sure that those children have the best care they possibly can? And that involves making sure that the mother is in the best condition that she can be.